Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, we have the expert team of the doctors, so you can definitely take the advantage and WhatsApp on 922681060. My dear friend, this is the series going on where Dr. Deshpande is discussing the different cases, different patients, how they come with the complaints and how the medical general practitioner, family physician can think over it and give the proper advice, do the proper examination, do the proper investigations. Today, we have the patient of 50-year-old male patient, and he come to the doctor. He starts complaining. Doctor, you see that my left knee is paining very, very badly. Especially the pain is more when I want to get up from my chair, get up from my bed. So getting up from the sitting position, I am having a doctor very tremendous pain. Please do something. Okay, okay. Please have a seat, my dear friend. Please have a seat. So then the doctor should think about the various possibilities. So how he can arrive for the knee joint pain, how the doctor can diagnose that particular condition. So first thing, the doctor can ask to the patient, sir, please tell me how long has it been painful? Doctor, you see that this is not a regular basis. It is coming very badly and then resolving little bit, but again start coming. So this is a, on and off that I am getting the pain, but nearly it is a 2 year time that I am suffering from this knee joint pain. I am now 50, sir. It is from nearly about 48 years. It has been started. So, okay, okay. The doctor should think in the mind that this is a case of chronic knee joint pain, chronic arthritis. This is a chronic condition, not acute condition. So there are two possibilities. One, according to the age, this is osteoarthritis, old age problem, degeneration of the bony joints, removing or reducing the synovial fluid content, and the dryness is arising over there. Osteoarthritis, arthritis of the old age because of the degeneration. But second possibility may be because from the age of 25 to 45, this age group is also having the probability of rheumatoid arthritis. Try to understand. But rheumatoid arthritis is not a degenerative disease, it is autoimmune disease. But there are different features of rheumatoid arthritis. Specifically, smaller joints are affected to begin with. Beginning is from the metacarpophalangeal joints. Metacarpophalangeal joints. Can you see metacarpophalangeal joints? And then it can spread all over the body. Rheumatoid arthritis is also not curable. Please try to understand, because many people, they come to us, doctor, we have suffering from the deformity of the rheumatoid arthritis and it's very painful. Can you cure this disease? No, no, my dear friends. We are ethical doctors, MD doctors. We don't give any false assurance to any patient. We are honest. We are ethical. So rheumatoid arthritis, whether you take allopathy, Ayurveda, homeopathy, naturopathy, one cannot say, I have cured 100%. No, because natural course, it is up and down, up, down, up, down, up, down, like this. Better days, bad days, good days, bad days, good days, achhe din, bad days, very painful. So there is a natural exacerbation and remission. These are the medical words. This is the typical feature of rheumatoid arthritis. This is bilaterally symmetrical. When my right wrist is affected, left wrist is also affected. Right elbow, left elbow. Right shoulder, left shoulder. This is a typical feature of rheumatoid arthritis. Symmetrical joint involvement, small joint involvement, and morning stiffness is more. As the day passes, whenever the patient gets up, all the joints are locked and very painful. This is rheumatoid arthritis. Sometimes there are different tests that you can do in the laboratory. One of the tests is RA factor. But of course, RA factor is positive in only 20% cases of rheumatoid arthritis. 80% can be RA negative rheumatoid arthritis. Yes, this is possible. RA positive rheumatoid arthritis patient, RA negative rheumatoid arthritis patient. But of course, this old gentleman has not that type of the problem. He is most probably having the osteoarthritis disease. Doctor's mind, inner mind is saying that this case is a knee joint, left knee joint swelling, pain, osteoarthritis. Rheumatoid arthritis is a very least possibility. Okay. Now, I am asking, sir, can sometimes this your knee is becoming swollen? Swelling is there? Yes, doctor. It is true. Sometimes it is painful, sometimes swelling and painful, both the things. Okay. Do you have the fever at the moment or last 2-3 days? No, nothing like that, doctor. Because whenever there is a fever, it indicates infection is there. Infective condition is indicated by the fever in any disease. So infection is common and fever is an accompanying feature. Now, doctor has to compare right knee, left knee. Doctor will compare both the knees, right and left. Right knee, how much is the swelling? Left knee, how much is the swelling? Right quadricep muscle wasting is there or not? Left quadricep muscle is there or not? That is also seen by the doctor. Okay. Next, what doctor can do for the osteoarthritis? If there is a swelling, doctor can do the patellar tapping test. Please see that patellar tap test, number 1, and second is a fluctuation to check the fluid. A positive patellar tap test, if it is coming, suggests that there may be fluid inside in the knee joint, that is effusion, fluid inside the knee joint. A small effusion, automatic will go, automatic, no problem, nothing to be worried. But if there is a large effusion fluid inside, that will require the aspiration by the orthopedic surgeon. Aspiration that cannot be done by the general practitioner. Better to refer to the orthopedic surgeon. Next, what doctor can do for the osteoarthritis? Test for tenderness. Tenderness means when the doctor is touching, patient is screaming, grumbling, that is tenderness. That means whenever the doctor touch, it gives the pain, tenderness. So if there is a joint line tenderness is seen on the left knee osteoarthritis, then if single spot is the tender spot, that can be detected. And one interesting thing, if we can detect that tender spot, Ayurvedic physician can do the Agni Karma over there. We say Suvarna Shalaka Dahana Karma. Gold wire is with us and we do the little bit thermo type of treatment. Okay. So if tender spot is there, then one can, in the modern pathy, orthopedic surgeon is doing LHC injection. LHC injection, local hydrocortisone injection. Steroid is given and steroid is always anti-inflammatory. So Kinacort, for example, injection Kinacort can be given locally in the joint, osteoarthritis. Okay. Now next, what doctor can do? Ask the patient to lie down on the table, flex the knee. Doctor has to flex the knee, doctor will keep the hand over the joint, and when taking the knee near, folding, keeping the hand on the top, flex the knee. So what is the purpose? There will be sound, a crepitus. Crepitus is a typical sound in the bony joint during the movement. And crepitus is very, very special in osteoarthritis because synovial fluid becoming less and roughness is there. Crepitus. Crepitus is felt in the left knee joint osteoarthritis. Okay, this is one of the important feature. Then locking of the joint. Sometimes the joint is locked. Locking of the joint suggests there is some loose body inside there. Next, the doctor should ask the patient to turn backside of the knee. That is a popliteal fossa. Popliteal fossa on the backside of the knee. Doctor should observe the popliteal aspect of the knee joint for Baker's cyst. Baker's cyst, B-A-K-E-R, Baker's cyst. So all these things has to be taken into consideration, and then doctor can start prescribing the medicines. But before prescribing analgesic, anti-inflammatory, the tablets for pain relieving tablets, they are called as NSAIDs. Pain relieving tablets in osteoarthritis, NSAIDs, N-S-A-I-D capital, non-steroidal anti-inflammatory drugs. NSAIDs, pronunciation is NSAIDs. But before prescribing NSAIDs, please, doctor, patient should take care. Doctor should ask the patient whether you have any acidity, epigastric burning, peptic ulcer in the past. Are you taking any treatment for that? If the patient is of gastritis, burning, acidity, ulcer, no NSAID. No. Or given after food and with very cautious. Second, the doctor can ask about bronchial asthma history. If the patient is known case of asthma, take the precaution while prescribing NSAID. Patient also should take precaution. Also check the blood pressure of every senior citizen. If the hypertension is there, don't prescribe steroid. No Visolon tablet, no Decadron tablet, no Betnelan tablet, no steroid. Corticosteroid should not be given to the ulcer patient and to the hypertension patient. I think this is very clear. Now, what are the important points in this knee joint osteoarthritis? Number one, there is one instrument also in the market. Please write down the name, goniometer. Goniometer is used in the research purpose, not in the by the general practitioner, but goniometer is very good for research to assess the movement of the knee joint. Goniometer. So range of movements can be detected, tender spots can be detected, fluctuation to see the fluid, patellar tap test is very important. And what is the management? Modern management, NSAIDs. Then some ointment can be given, like for example, Voveron tablet, Voveron gel. If pain is severe, then injectable, intramuscular Voveron injection can be given. Then doctor can suggest physiotherapy, SWD, short wave diathermy. Also LHC by orthopedic surgeon, local hydrocortisone injection. Maintain the NSAIDs, that is slow releasing tablet. For example, Voveron SR. SR means slow releasing, one tablet at night. So whole night will be without pain. Then knee, whenever the pain, swelling goes, everything is okay, patient is comfortable, then never forget to ask the patient knee joint exercises. My dear friend, there is also very interesting videos on my Ayurveda Academy channel. There is a yoga, 1, 2 joint exercises. Please see those videos. Very simple exercises I have explained on the basis of yoga. Okay. If the patient is obese, the weight reduction is mandatory. Unless and until the patient reduces his weight, that knee joint pain will not subside, because that is a weight bearing joint. And also, if the patient is quite old, then better way he should take the support of walking stick or some other instruments while walking, because there is a danger of fall. So my dear friend, this is all about the today's case of left knee osteoarthritis for the senior citizen. We will going to be discussed such type of the cases in future also. So I request all of you to like this video, share this video, and don't forget to subscribe my YouTube channel to boost the energy of Dr. Deshpande. I wish all the best, take care, and see you in the next video.